Tom O'Leary from O'Leary and Associates Training and Consultancy, and we are delivering these programs or these workshops on behalf of Kerry PPN under the Training Links program funded by the Wheel. So this morning's session is on looking at risk assessments in your organisation and how to prepare a safety statement and why it's important to understand the whole area of health and safety within your organisations. So we've asked Denise O'Brien from Watch Your Back Ireland to deliver the workshop this morning on her behalf. Denise is based out of our offices in HQ in Tralee and is an associate of O'Leary and Associates for the last number of years and has been delivering some programs for us in the past, and also has done kind of a revamp of our own health and safety policies and risk assessments, I suppose, in light of COVID over the last 2 years in our offices in HQ Tralee. So I've asked Denise this morning to deliver the workshop based on our experience of working with organisations both in the not-for-profit sector and the for-profit sector, and to outline to you, I suppose, what's involved in health and safety, risk assessments, and why you need to have a safety statement for your organisation. So I suppose the whole purpose of these workshops that we've been delivering before Christmas and we're delivering now over the next number of months is to, I suppose, give you the tools and information that you can organise and have, I suppose, better run your organisations, and to be aware of all the things you need to be aware of when it comes to operating a proper, well-structured, well-funded, well-organised not-for-profit organisation. So a key thing that we would have come across over the last number of years is there's a lot of issues, gaps within the whole area of health and safety and policies. A lot of organisations are kind of operating on fairly thin ground out there in relation to health and safety and compliance. And that has come up as an issue over the last 12 months with a few of our organisations we work with in relation to their insurance, that they would have been insured for the last number of years, but their insurance policies are pretty much null and void because they don't have any safety statements, risk assessments carried out. So it is a huge issue. It's a bit of a ticking time bomb for a lot of organisations. So I think it's really important that after this morning you understand what you need to do. And I suppose most importantly, what you need to do after this morning to look at how you can bring your level of compliance up. We're not there to kind of frighten the life out of you in terms of scaring you, but it's really important that you understand the consequences of not doing this right. It's one of the areas that are really, really, really important. Outside of finance or anything like that, this is a key thing that's coming up and it's impacting a lot of organisations. So I'll be handing over to Denise now. I won't be staying on this morning in the workshop with you, but just let you know, as Caroline said, we are going to be delivering the workshop next week, next Monday morning and next Thursday evening on the Charities Regulator Governance Code and looking at governance compliance for not-for-profit organisations. So I'll see you again next week and I'll hand you now over to Denise. So enjoy your session this morning and hopefully you get a lot out of it. Thank you.
Thank you, John.
Thanks, Tom.
Okay, I'm going to share the screen. Somebody had just asked me to hold off because they were taking a picture. So am I okay to go and share it now? I presume so. Okay, so just to introduce myself, first of all, as Tom said, my name is Denise and I have a company called Watch Your Back Ireland. This is my 4th full year, I suppose, as self-employed. I met Tom when I was doing the Start Your Own Business course 4 or 5 years ago. And then I ended up taking an office space in HQ. And from there, then we just ended up, I suppose, doing bits and pieces together. Just an introduction to me. I'm not here to sell you anything, and I'm not here to put the fear of God into anybody either. And I sent Tom the slides yesterday to have a look, and he came back and he said, God, I hope you don't scare them. And it's not to scare anybody, and it's not to sell anything. Any of the stuff that you need to do, you can completely do yourself. It's within, like, the health and safety website is really helpful to somebody who's just trying to better their own health and safety. So I'll show you all the bits and pieces that you need. I'll try and break it down into the areas of risk assessment, safety statement, legislation and emergency plans and stuff like that. But if there's any questions or anything, just let me know and we can answer them as we go along. I'm just going to go back here now to make sure I have the right button. Okay, so first of all, I just wanted to talk about the difference between legislation, guidelines and documentation and the difference between them, because sometimes people misunderstand what they actually mean. So what I do most of the time is research and dissect the legislation and the guidelines and then turn them into more understandable documents for clients. So I screenshotted some of the ones I had here from my own desktop, which would be the COVID-19 Risk Bible edition. It's edition 4 because obviously we had to change it when vaccines came out and when legislation changed. the HR Bible, pregnancy risk assessment, health and safety guide, mandatory health and safety. So what we do is kind of make it easier for people to understand. And even though a lot of the work would be with employers, like the same legislation applies to any organization that you're in. So I saw a couple of the different names popping up when you were in the meeting room there, and some of you are voluntary bodies and not-for-profit. You're bound by the same legislation simply because you're in Ireland. And sometimes people don't realise that. So that's what I want to try and break down for you this morning. So a summary of what we're going to do today. So I just make sure I haven't missed a slide. So a summary of what we're going to do today was what was in your ticket or the information when you would have booked the session. So to talk about risk assessments, how we identify the hazards, how we assess the risks, decide on how we're going to rate them and implement any control measures. Sometimes we can't put in any control measures. The duties of the organisation or employer and the duties of the employee or the members, so the volunteers, anybody who enters your organisation, basically. The importance of a company safety statement. And I think people largely misunderstand that this is a legal agreement. Like, your safety statement is your agreement between you and the organisation on how you're going to protect everybody who enters, how to renew it, need for emergency procedures, company safety committee and its functions, and safety systems of work, and just the requirements for method statements and things like that. So it sounds like an awful lot of paperwork, and I don't want anybody thinking like, God, this is an absolute pain in the ass. Like, you can simplify it, and you're better off to try and do some of the work yourself so that you understand it better, and that way then it's not going to cost you a fortune either. So the first important thing is to differentiate the difference between legislation and guidelines. So legislation, we're bound by it. So breaches are considered legal and they face prosecution, fines, etc. So legislation, we have legislation in Ireland for all kinds of different things. We have criminal law, employment law, we have health and safety law, there's land law if you don't like your neighbours, if you don't like the tree or the wall that they're putting up. We can take all of these people to court because they're bound by legislations, whereas guidelines are not legislated. They're guidelines from an expert authority, usually telling us something that's good guidelines or best practice. And COVID is a really good example of this. So, you know, we were given public health guidelines, and the guidelines were wear masks, stay 2 meters apart, but this was not legislated. So because it wasn't legislated, the guards were given emergency powers to follow up on non-compliance. So there's a difference between not following a guideline and not following legislation. So in Ireland, you might have heard of the HSE, which is the Health and Safety Authority. Now, the website is great. They've a really helpful setup. Anything that you're looking for, they have everything. And even if you contact them for support, they offer a load of free support. So I would definitely say, instead of considering spending thousands on something, you might first look at the website and see what it is you actually need. So in Ireland, whether your organisation is a business, a place of employment, voluntary body, not-for-profit organisation, a support group, we're bound by the Health and Safety Authority. And this often surprises people outside of the employer and business scenario. There's loads of tools on the website. There's free assessments, templates, but I suppose there's nothing to replace the security of carrying it out properly and understanding it and knowing yourself how to review them. So it's not just something we do to tick a box. It's actually really beneficial to understand it as well. So I encourage you to want to understand the risks associated with your organisation. Okay, so there's 9 acts. Now, you know, acts, sometimes if you're not working with these every day, sometimes people wonder where they come from. If you've ever watched any of those criminal things on the news or any of those series on Netflix, when people are being arrested, you'll hear them being arrested under Section 9 of the Criminal Justice Act and all that kind of stuff. Similar with health and safety. Nobody comes to arrest you unless there's obviously a criminal charge with it as well, but you will get paperwork and you'll be told, you know, that you have breached the Safety, Health and Welfare at Work Act or the Organisation of Working Time Act. And all of these things like are relevant in different industries. All of them mightn't be effective to you in your organisation, but safety, health and welfare at work would be the most important one. We have chemical acts, chemical weapons. Like, people might look at chemical weapons and go, Jesus, what does that mean? So chemical weapons actually refers to first aid. And this is usually the point where people decide that they're maybe going to listen to the rest of the lecture on it. Did you know in Ireland that outside of a hospital setting, if you pass somebody a paracetamol, unless you're a pharmacist and they're buying it or you're medically qualified to give it to somebody, it's actually illegal. And here are the numbers in Ireland of accidental paracetamol deaths over the last 4 years of people that were given paracetamol by strangers on holidays, relatives at hen parties, workplaces, organizations, somebody thinking they were being helpful and not taking into account the risk of I know nothing about this person. I don't know how paracetamol works. I don't know if they're on any other medication. I don't know if it's contraindicated. So sometimes paracetamol is a great example of getting your attention to just explain to you like that there's risk associated with all of the things. Like how paracetamol works is people take it generally if they have a headache. So people take it to try and bring down the bit of pressure that you have inside in your head. So obviously that works in some way to relieve blood pressure. So what if somebody's already on a tablet for blood pressure? What if somebody's on blood clotting medication? They mightn't give you that information, because if you're on a volunteer's day out day and somebody asks for a paracetamol, generally we think it's safe enough to give it. So something like that, you can see there last year, 2020, there was 235 deaths. Like that's something we can all completely avoid by just knowing that it's a risk. So that's what I mean about getting to know the risks and understanding them is far more beneficial than just filling in templates from the health and safety website. So alongside those 9 acts, we then have 10 codes of practice, and codes of practice kind of tell us they're guidelines again on like what way we should manage things, what we should do. So you'll see stuff there like farm safety, avoiding danger and underground services, code of practice for safety and roof work. You know, you see a lot lately when a woman gets attacked, because it's generally a woman that gets attacked. You see a lot of this nonsense of like stop telling women to not to walk on their own in the dark, or not to park far away from their workplace, or not to be doing this and this. But the fact of the matter is, if you have somebody working or volunteering for you and they are in a dark car park and they're walking a certain distance late at night to a dark car park, even though we should as women be able to do stuff like that, there is an element of risk involved. So if you're looking at the physical risks you're building, and one of it is the car park is dimly lit, and actually the walk between where the volunteers or the members go from the building to the car probably isn't the safest, that's something that you need to take on board as a risk as well. So we have legislations that we need to follow, and then we have codes of practice that offer us the best advice and the most up-to-date advice on what we should do with those things as well. Okay, so how we identify hazards then. So like how we look at risk is we have to go in and assess everything. And there's so many different types of risk. Like there's physical risk, chemical risk, like there's so many different types. You need to know what you're looking for. So the first thing that you have to do is to identify them. So you need to be able to look at something and go, okay, what could potentially cause harm here? And it's not, sorry, I saw someone in the waiting room there, I'll let them in. It's not so just that, you know, you're taking a box and getting the paperwork done. You should be able to look at your premises, and whether it's an outdoors, maybe it's just an online space. Like sometimes people just have an online space. I know there's a particular miscarriage association and they just meet online, but actually like there's still a risk online. Like you obviously have the online risks of hacking, somebody not being who they said they were, you know, somebody recording it. There's a whole safety thing there. There's a whole thing about protected disclosure. So you don't have to be in a big building full of firearms to think that there's risks to be identified. So identifying them is the first thing. Determining the level of risk then is the next thing, because sometimes there's risks we can do nothing about. Half the businesses in Listowel will tell you there's nothing they can do. If there's going to be a downpour, rain and a risk of flooding, their premises is going to get flooded. Yeah, that's a problem for insurance. Their only option is move to another site, which may not be feasible for them. But sometimes there's nothing we can do, only manage the risk when it comes. So what you need to ask yourself is, what is the potential risk here? Like what is the maximum risk that could happen here? And most of the time, obviously, we're looking at something like a serious injury, a near miss, or a fatality. And if we look at something that there's a risk and we think, okay, the ultimate risk here would be death, obviously you need to put in controls and inform people. Sometimes it's things that you can do nothing about, you know, like something is on the end of a dodgy road or the end of a busy road. And we put in controls then for stuff like that. So if I was to, I don't go around every day, by the way, looking at the risk of everything. Like I don't sit and go, okay, I can't go out to the car park now. I could get a belt of a car outside. We know in this country, we have legislation and guidelines to prevent that. There's controls in place. What are the controls? Well, we have the Road Safety Authority. Cars have to be NCT'd, so the cars are safe. Drivers have to have licenses. There has to be insurance. There has to be tasks. The county council look after the road. So there's controls in place. Even though the roads mightn't be a safe place to be, there is controls in place to try and minimize the risk. So that's why, even if we look at something that we feel we can't do anything about, we can still make a plan to put in controls and train our people about it. Okay, just want to make sure I don't skip one on. Yes, I just wanted to show you some pictures of a couple of places that I had risk assessed. And they're things that people hadn't thought of. So the one there on the left, I was in a building and I just said, like, is there a way in and a way out? You know, for fire safety, it would be beneficial if you had a way in and a way out. And I said, yeah, come out the back. There's a window out the back, but like you'd get out the window. So I said, okay. And I went out the back and there was this prison, Mountjoy-esque type window that I can't ever see myself fitting out any of the bars. So obviously that's a complete risk. Now, the options are to just admit that you don't have a way in and a way out if there is a fire, or you move that, you get rid of the bars and you move the place that you have an exit. So then you have to look at, well, what's the likelihood of having a fire in here? But in the same place, you'll see there on the right, and this was in the very same room, there was gas cylinders, electrical items, hoovers, a lot of plugged in things, old Christmas decorations, flammable stuff that could easily go up in flames. So if you're looking, saying, okay, we don't have a back exit here, if there is a fire, we need to minimize the risk of the fire unless we're going to change the back exit to something else. So that's why you have to weigh up what the risk is and what your hazards are and what you can do. Here's another one. Most of you might have Burco boilers, and you probably have them if you're offering tea or coffee mornings, or you're meeting up with your members, your volunteers. Burco boilers are fine until Johnny, who's 10 years of age, doesn't seem to understand, stay away from the hot water, or Mammy lets him off when he's home and she's getting her hair done. And all of a sudden then Johnny has burnt his hand. And, it's this thing about, okay, well, what do I need to do? I still want to offer tea and coffee to people. Put up a sign, and the sign needs to say, be caution, boiling water, please do not leave children unattended by the Burco boiler. And so you don't need to remove it, but you just need to make sure that you've put in a warning and you've put in a control, so that when little Johnny burns his hand, you can make sure that you're not responsible for it because his mother or father was obliged to look after him while he was in your premises. And then here as well, you'll see under the desk, and now this happens in an awful lot of places because we have wires, Wi-Fi routers, modems, all the different things. But if your Wi-Fi goes down or if something happens, like, it's an awful mess to try and fix everything, not to mention, of course, the electrical hazard that there is there as well. So those are 4 simple pictures that I saw from other places that I was in. The other one was, you notice the red heel is kind of our logo. When I started out first, anytime I had a labour court case, I would wear my red shoes, and then it became my logo. So then it just became my work thing to wear it. But I went into Dublin one time to carry out a risk assessment, and my heel got stuck on the way in the door, and it was a women's fashion premises. So I was like, listen, like, I'm not the only person walking through these doors with heels. Whereas if it was a man's boot shop, I don't think the risk would have been the same. So that's why, like, the risk will be different to the industry that you're in at the time. Okay, so risks come under a lot of different headings. There's a lot of, and this isn't even the complete list or anything like that. So we have physical risks. So there's 2 types of physical risk. The physical risk obviously is the risk of the building. So looking at if there's a building that you use for your workplace. I saw there's a beach or a swim club on this list there as well. So your physical space might actually just be the beach, which carries its own physical risk. But a physical risk in buildings are often things like, poor banister and the stairs, poor lighting in a dark place, the car park being far away, maybe not being very secure. So you have a physical risk of the building. And then you have a physical risk to the person. So, like, if there's somebody coming in who is a wheelchair user, if somebody who is a volunteer gets pregnant, what is the risk to them? So you have all kinds of physical risks as well. Chemical risks then would be the different chemical agents that you might use. And chemical agents are anything from washing up liquid all the way up to every other type of serious chemical. You have biological risk, financial risk. So if you have some kind of fundraisers going on, or you have somebody that looks after the money, or if it depends on taking money from parents or children or something like that, there's always a financial risk if there's any handling of money. And how you put procedures in place for that is just, okay, whoever is taking the money in, 2 people should count it. Whoever is in charge of the bank account, 2 people should sign it out. Like, there's easy ways of controlling those things. That your health and safety project doesn't need to be a massive thing at all. Fire risk, then you have manual handling risk, you have electrical risk, you have ergonomic risk. So ergonomic will be, sometimes you might have somebody who does a bit of work for you, paid or not paid, and they might be sitting at their laptop at home for 3 hours once a week doing it. But over time, they might go to the physio because they have a pain in their neck or a crick in their neck. And then someone says, oh, are you sitting at a desk? And were you ever ergonomically assessed? And when you were asked to do that work, and they say, oh, well, it's not a paid job, so I didn't think, that I had the right to be asked to be assessed. Like, if anyone's doing anything for your organization, they don't have to be an employee for you to be bound by the health and safety legislation. So that's the important thing to remember. We have medical risk, we have children's first, which, a lot of people need for if you're training kids, football or soccer. And then you have vulnerable adults, and vulnerable adults are anybody that's over 18 that has any kind of different learning ability. They might be in residential care, they might be on day services, you might be doing a special class for a group of people that have autism, because I know they like to look at particular tasks, say for activity therapy. So you need to look at what are the potential risks that are coming into your organization and what controls can you put in place to protect yourself. So we don't live in America, thank God, and we don't have the opportunity to sue people every time somebody upsets us. But the thing is that there is legislation here for this. Like, we are supposed to be following the health and safety legislation of the country that we operate in. So I've put up there besmart.ie, and I had a chat with Tom about BeSmart the other day. Like, BeSmart is a great website for you to go on and get some free tools, but BeSmart depends on you knowing how to input all the information. So like, your template that they will do for you for free is only as good as the information you can put in. So if you can sit in your premises, or even if it's an outdoors, and you can look at all the risks, enter the information properly, then BeSmart is great for you and it will really help you. But if you're not sure where to start, or you're not sure if something is a risk or not, I would say go the extra mile and get a little bit of help with it. And then the next year you'll be able to do it on your own. So it is a really good resource, but you know, it's banking on you and putting in the information correctly and being able to understand the questions that you're being asked. Okay, so just to categorize risks then. So what we would say is, like, what is the minimum and maximum risk with each hazard identified? What's the likelihood of it occurring? If we're talking about flooding in Listowel, I mean, there is a likelihood it could happen here for 10 weeks a year. It might happen once every 10 years, but there's no way that any of us could measure that. It doesn't go on any kind of systematic review or anything. What is the severity? You categorize based on this, and then you implement any training or procedures that you might require. So this then forms your risk assessment document. So there'll be some risks that you can't do anything about, only to observe. COVID is a really good example of how to assess the risk. So COVID itself became a risk and something we had to manage over the last 2 years for everybody. So replace COVID with whatever other risk, and you ask yourself, okay, what is the risk? Like, what is it? COVID. So it's a viral respiratory illness. How does it spread? Transient organisms by touch, droplets from the nose and the mouth. So what's the immediate risk? So we know those that are immunocompromised are the immediate risk. What can we do? So we have guidelines. The HSE have given us guidelines. So we know, okay, so the transient organisms by touch. So what do? We wash our hands all the time, or we wear gloves if we're in a work environment that we need to. Okay, so the droplets from the nose and mouth. Okay, so then we wear a face mask, or we stay 2 meters away from people. We have a load of guidelines and public health guidance on this. So we've been told how to minimize the risk. So how often should we review this then? And as you'll see earlier, I was showing you the COVID Bible that I've done, and it's version 4. And it's version 4 because version 1 was done in March 2020. And then we ended up with vaccines, and then we ended up with boosters. But now we have more evidence as time goes on. So we're not just guessing anymore that it might be a risk to a pregnant woman, or it might be a risk to somebody who has asthma. We have the science for that now. So anytime that stuff gets updated, we can then update our risk assess as well. So what is the ultimate risk? So the ultimate risk is death, unfortunately. And obviously that risk is high. So we need to regularly review it. And then even at the end of your risk assessment, if you're not sure about something like that, nobody's going to grade you on this. This isn't something, you know, you get a pass or a fail on. It's something for you that you should do so that you're aware of the risks. So that if you're leasing the premises out to somebody, if somebody's renting the community hall for a birthday party, or somebody's hired you for a birthday party, or whatever it is, that you can advise anybody who enters just the associated risks. And that's something, like, this is something you should be doing anyway, because it's supposed to be something everybody is doing. So when you put down your recommendations, you can be uncertain about stuff and say, you know, not sure about that wire that's hanging out of the wall, going to ask an electrician to look at it. It's okay for this to be a work in progress. It's never going to be a completed document all of the time. So I just want to go back to COVID for a second. I want to show you how health and safety is not a full-time responsibility, but it is an ongoing one that should be reviewed. So earlier on, just there, I said COVID was a great example of risk and how to assess it. I mentioned that it should be reviewed when things change. So I just want to show you that I had to add an update to the risk assessment then as things changed. So over the last 6 to 12 months, I was assessing somebody who was pregnant in a high risk environment. But since the last risk assessment, because you would normally do one at 3 months and 6 or 9 months for the pregnant person, volunteer, employee, whoever it is. So we had to add in things like, well, did the GP now say that they were at risk? Because the GP has that information to add. Is there risk amplified by being pregnant? Is there risk amplified by being at work? What are the main workplace risks? And then vaccination. So has the employee been offered the ability to have a vaccine? Has she accepted the offer? And like this, and vaccination and asking people about it is a whole other day's Zoom, because we have clients in the healthcare sector who we have to ask. We need to know if somebody's coming back to work, if they're vaccinated or not. And then there's some industries that we can't ask. So COVID being an example is something that has evolved over the last 2 years. It has allowed us to add to the risk assessment, add some facts to it, and we now think that we know how to manage it somehow, that at some point we should just be able to live with it. Okay, so that's the end of risk assessments. So I want to move on to the health and safety statement, because you would only move on to your health and safety statement once your risk assessment is completed anyway. So the health and safety statement needs to be on display for all who enter or all who are part of the organisation. So if you have a physical space, it should be on display at a reception desk, on the door. It's also the very first thing you'll be asked for if there's ever an accident that happens. The minute somebody would report it, whoever would come down from the HSA or the HSE, depending on your setup, they'd ask you for your safety statement. So your statement, and it's called a statement because it is signed by you, you have to physically sign the document, and with somebody, if somebody else has done it with you, you have to co-sign the agreement. You're basically undersigning that you've risk assessed, and any measures that you have put in place, this is what you've done, this is your plan to review it, and that's your promise to the organisation and all who enter it of how you're going to keep everybody safe. So this is just a kind of a screenshot of one we were doing there lately, just to give you an example. Like, it's not something that's a big long document. You're basically undertaking that you've done a risk assessment, and this is your promise to provide a safe place, to continue to identify hazards, to consult with staff, to provide protective clothing and equipment where needed, to provide a safe means of entering and leaving the building, safe work practices. So it is something that you could probably copy and paste off the internet, but you are better off to just understand what you're putting in it, because there's nothing like understanding the document and knowing the work that you have done, as opposed to just, you know, copying and pasting something and hoping for the best. So what should be included in my safety statement? Anything that you've done to comply with the legislation, all of your undertakings, the risks identified, your plans, how often you plan to review them. In terms of how often, like generally health and safety is something that you should be probably do the work, do your risk assessment, get your folder together, and then say, okay, in 6 months, I'm going to review it, unless another risk is identified or something massively changes with a measure that I've put in place. Any measure you have in place that's under more frequent reviews, so just if something requires more regular updating, any training you've implemented, who your safety officer might be, or a point of contact for concerns, ideas, or feedback. Generally, your health and safety statement should be between 3 to 7 pages. It's not an extensive document, but it should just be, it should provide support to you if there ever is an accident, that people can say, no, the company had completely looked after their obligations, like accidents happen anyway. Can we just buy a template online? You completely can, but that's just not the safest thing to do. So if you're inspected, you'll be asked for your statement first. If there's been a complaint, accident, or concern, and complaints happen the whole time, you know, we the whole time would have people contact us and say, oh, a customer complained that I asked him to wear a mask, a customer complained that I didn't ask him to wear a mask. So like people have nothing better to do sometimes than to be sending a complaint to somebody at 7 o'clock on a Monday morning, but that's okay, because the best thing to do with a complaint is to go, thank you very much for your complaint. I'm going to use it to educate the staff better. This is why this occurred. Please see your health and safety statement. So by undertaking to properly assess your own health and safety needs, your statement needs to be factual and correct. You need to sign your name to it. And generally, if I'm the consultant involved in it, I would sign mine too, so that if they need to contact you, if they have a concern, you know exactly what your name is signed to. So that's why we don't do the generic documents, because I would just absolutely hate my name to be on something and I have no idea. The place could be a complete risk. They could be lighting bonfires at the back with petrol every day and using my template. So we don't allow for stuff like that. It's something that you should be proud that you have completed, and it needs to be there for everybody. So who's responsible for the health and safety needs? Everybody involved needs to play their part, but whoever has the most authority, I suppose, or responsibility should look after the health and safety needs, or appoint somebody to do so. And as I said, this isn't a full-time thing at all. Even if you're hiring somebody in to do it, and I have more information on this at the end, like this isn't something that's somebody's full-time job. It never is. Even in, like, if an organization had hundreds of thousands of staff, they might have a full-time health and safety person. But other than that, it's just a project that needs to be looked after the same way that your accounts do. So the obligations, your legal obligations of the organization in terms of health and safety: risk assess, provide safe as possible space for everybody who comes in, volunteers, undertakes time, whatever it is. Appoint a health and safety officer or a point of contact. So that just means if you've somebody within the organization, maybe it's you today listening to this, you've decided, I'm going to take a hold of the health and safety stuff, put your name to it. There's loads of courses online that you can do to inform yourself, or a point of contact. Like you might decide, like Tom said there, we do the health and safety stuff for HQ. So when I first went into HQ 3.5 years ago, we had never heard of COVID-19, and the biggest risk was like, would there be milk in the fridge when you go up for your coffee on a Friday afternoon? And now it's turned into like co-working space is brilliant, because it's like having workmates you can vent to without actually having workmates. But COVID has turned it into having to have masks on when we talk to each other, and we've hand sanitizer everywhere. But what that has done as well is nobody's ever got COVID in the building in the last couple of years, and everybody has been able to continue going to work over the last while. So I think maybe 3 or 4 times over 2 years, they've reached out to say, look, we need to update our health and safety statement with COVID because we've implemented something new. So that's what I mean. You don't pay somebody on a long-term basis to look after it or anything like that. Space is not always physical. It can be an online space, adequate health and safety review and input, your training methods for all who enter. So when I say training, people often think training has to be something, really serious and formal. With training, once you've done your risk assessment and your safety statement, put them onto slides like this. This is what we would do. If I was after doing a risk assessment for somebody, I would put it back onto the slides. You bring all the team on a Zoom and you go through the documents with them. And that's their training. And I tell people record it like this so that they can use it again. So it's just an important part that like the training doesn't have to be from anybody up in Trinity doing it. Sure, who's the best person to train your members on your health and safety stuff? You, the person who understands it better. Safe methods of work. Safe equipment, safe space for all who enter, and a safe space for anyone that has any safety concerns without the risk of penalisation. And just asking for help for somebody if you're not as experienced as you should be, or you feel that you need more support. And this is a direct quote there from the HSA. The responsibility for the provision of safe place of work rests with the management of the company. And that's not work as in employment work. That just means anybody who enters the organisation. So our next one then is the legal obligations of everybody who attends. So this would be visitors, contractors, temporary members of staff, anybody who uses your services. Might be clients, you might have people that are coming in for lessons. So their duty is they have to undertake any provided training. And by training, again, I mean going through your health and safety documents on Zoom with them. Provide feedback to any safety risks, not to intentionally cause harm to any equipment or property, to cooperate with all the rules, to be aware of the nearest fire exit, emergency procedures, medical supports, never to put the organisation at risk, and to follow the procedures and record incidents clearly. And that's really important as well, because like you might be feeling, oh my God, I have a load of work to do. But it's not about that at all. It's about getting it in order. And then whoever your members are, whether it's 1 or 101 people, bringing them on a Zoom to chat through this, and they know their obligations are to abide by the rules. So you're not responsible for Mary being safe as long as you've told Mary what your expectations are and what the company policy is on it. So the other thing that was mentioned was emergency procedures. And I suppose emergency procedures is something we always do for even for the business clients as well, because having an emergency procedure in place, like the whole purpose of it is to avoid panic at the time of emergency. So it's something that we focus on an awful lot, because at some point everybody will have an emergency. And it's just important to your organization that everybody is trained. And I don't mean just first aid trained for an emergency. I mean actually your emergent procedure, like who you're going to call, who the local people are that might be of help. So this could be an urgent medical event, heart attack, fall, an allergy, it could be a fire, evacuation, it could be an adverse weather, as we know in this country, it could be storm, snow, heat wave. So it is part of the HSA legislation that you have an emergency procedure. And trust me, there's always somebody who thinks that they're not going to have an emergency. And like the one time that you know you need an emergency procedure is when you have an emergency. And what I always tell people to do is laminate it, put it by all of the phones, or put it up somewhere that people see it often enough that when there is an emergency, they're familiar with it. So a few things, getting back to the paracetamol, just a couple of things that people may not know. So did you know in Ireland, there's 3 different types of an ambulance. So when you ring 999, if you know to inform them that actually you need a cardiac ambulance, because a cardiac ambulance has a 12-lead ECG and a regular ambulance only has a 3-lead ECG. So if I'm suspecting somebody's having a heart attack, I would tell them, please bring me the cardiac ambulance, so that by the time this person gets into A&E, the paramedics will have been able to pick up whatever it is that's going on. The other thing, did you know in the event of a brain injury, so a car accident, fall off a horse or a bike, a specific ambulance comes that has cooling, that provides cooling to the cervical spine, that only Cork and Dublin take serious neurological cases, and this could be life-changing for somebody. Back in 2014, a friend of mine had a really bad fall off a horse, and honestly, I don't know how she survived it, but she did. But I think it was because there was a nurse on scene at the time. They were in the middle of nowhere down in Cork on the hunt, like the physical horse hunt. And when she fell off the horse, there was a nurse there, and the nurse rang 999 and was like, we need a neurological ambulance and straight to CUH. And I think that 40-50 minutes whereby they were able to stop whatever bleeding was going on by providing the correct ambulance might have just been the thing that saved your life. So sometimes people don't know things like this. Do you know where your local ambulances come from? Do you know that here in Tralee, regular ambulance comes from St. Ida's in Newcastle West? The neuro ambulance comes from CUH. We have cardiac ambulances that come from Shannon and Cork. So do you know that, like, not only do we have 999, but we can have the numbers of the ambulance depot, which might be important to us for if there's a traffic problem and there's an ambulance on the way, or if we need to see how far away somebody is. So there are things we can do to make an emergency situation less stressful and less urgent for everybody. And that's really the benefit of having an emergency procedure. It avoids mass hysteria and panic. Sorry, there's someone else in the waiting room there. Just go back. It avoids mass hysteria and panic. Have it printed and laminated, have it near phone points so everybody knows where to find it. Have it in enough places that when there's an accident, somebody can see where it is on the wall or in whatever folder and they can just pull it. It reassures everybody who uses the organisation that even if the emergency includes them, that there's a plan for safety. It provides us with emergency information without delay, and it absolutely can help to save a life. You will never regret it. So what should you include in it? Local GP numbers, even on call and out of GP hours. Where is your first aid box if you haven't? Where is the nearest defib? Who has the key? Shouldn't we have that information like long in advance of needing it? Like I would know it to the point of the different counties. Like sometimes I could drive from Limerick back to Tralee and I drive to Raskeaton and I'm thinking, I wonder does Jimmy O'Donoghue still have the key of that defib there up in Centra? But like that's the stuff that's really important. The defibs are really important additions to the community, but they're only beneficial if we know how to access them and who has the information. Local fire station numbers, keeping next of kin emergency details for all who enter your organisation in case they're the ones that end up having the emergency. So like there's nothing worse than you have a man or a woman working for you or volunteering for you. You need an ambulance for them and we don't have details of their next of kin. Any medication allergies should be known. Now, it will tell you on the HSA website, and I would say the same when we're dealing with staff and stuff for people. That's completely up to somebody if they want to disclose that they have a medical allergy. I would 100% disclose it to anybody that I spend any amount of time with in case at some point a paramedic needs to know to save my life. So it's up to somebody if they want to disclose it. But when you are doing an emergency procedure, part of it is all who enter your organisation that they have the option to give you their next of kin emergency details in the event of an emergency, and that if they have any medication allergies or underlying issues that would, in the event of an emergency, like need to be known to paramedics or doctors, they have the option to give you that information as well. So anything else? Legally, you don't need to keep a record of all accidents, say like paper cuts and stuff like that. We don't. We would keep an accident, like near misses and serious accidents, what we keep for 10 years. So if somebody, any of the small cuts, the band-aids, we don't really keep them. You need to keep the important ones and near misses. And I will tell you why, because if somebody hurts their back or their leg and they're fine, 2 years later, they might decide they're not fine and they're still going to physio. So if you end up with a claim, a personal injury claim, HSA are going to come back on site and look for your record. So it's important that you keep proper record of it. It makes everybody responsible then for even the safekeeping of the first aid box. If somebody knows there was an accident last week, maybe I need to check the first aid box to restock it. Anybody ever find at home when you go to the first aid box, there's no burn cream and there's no plasters because nobody ever thinks to restock it after you've used it the last time, which completely defeats the whole purpose of it. Knowledge like this is not only useful in an organization, like this kind of stuff is useful to you way outside of your organization. Like this is useful to you when you're out with your friends, when you're with family, if you're at a wedding. Like you're never going to regret knowing enough information about having an emergency plan and all of the emergency facilities and services that we have nearby and how to access them. So they come in all shapes and sizes. They've fires, falls, trips, flooding, weather, people. And in a time of panic, your procedure provides structure and planning. So what should you do after today? So if you are not compliant or as compliant as you should be, you should just make a decision to start. You should appoint a health and safety contact within your organization, even if it's just you and you decide that you're going to give it an hour a day over the next 2 weeks. You would be so surprised at what you'd get done. If your organization is quite big, then you can form a safety committee to undertake this project and divide it out. You should aim to meet regularly on Zoom or in person and make a to-do list like until you have it completed. But the to-do list will include, so carry out a risk assessment of every aspect of the organization, like the stuff I said, physical, electrical, all of that. organise a date to provide feedback from this assessment, make an action plan for any serious risks identified, publish a risk assessment, and by publish now I obviously mean like internally, put a review date on it. Usually it's 12 months, depending on if we've somebody pregnant, sometimes we might review them 3 months, 6 months, 9 months, unless we've identified a risk. Draft your health and safety statement, draft your emergency procedure. When you have all your documents ready, get them reviewed by the committee or call in help from a health and safety consultant. So this isn't something that you need to think is going to cost you a lot of time or money either. Publish the document, again, I just mean internally, but also offer it on a Zoom training for all who enter your organisation, and regularly review health and safety matters, striving for education and compliance. How often should it be reviewed and when should it be completed? So health and safety should not that you should be going out every day thinking about it, but it should always be in your head that, you know, I need to look after health and safety. Maybe once a month I'll look at the risk assessment and have a quick look at it, but you'd only actually properly review it or reassess it in a 12-month period. There's no harm to keep an eye on your procedures, to stay educated with online courses. Like there's some really good courses online that are like the HSA ones are always free. There's other places as well, like Olive Safety and places like that. If you want to give somebody the accreditation within your organization, like to be able to do this knowingly and confidently. Anytime a new risk is identified, remember, if you train all of the team, then you have more support. Take this as an opportunity to review the others. Annually, you might be reviewing your statement, procedures and assessments, not only because you might need them for grants or funding, but it's also just the safest thing to do, and it's compliance. So I review any of the documents that we review. I review them and update them regularly. It should always be a work in progress. Like this is just an example of from one of my documents. Like that was my general health and safety stuff with version 1, version 2, version 3. And I keep all the versions because like all that shows then is that it's a work in progress. It doesn't have to be a new document every time. The bulk of the work in this is in the setup of it, is in you deciding that you're going to do it, getting your risk assessment template, carrying it out, getting feedback on it. But once it's done, it's something that's not going to cost you a whole load of time. So I suppose one last point, just about safe systems of work. A lot of the health and safety talk is generic and can be translated across any business, company, organization. Separate to that, the work carried out in each place should also be reviewed. By work, I mean, like, what is the actual physical task that they're doing? Are they manual handling trained? How much of the role is physical? What happens if there's an accident? What happens if there's a pregnancy? These are physical risks. So if you have people volunteering with the public are a risk themselves. Like people are the biggest risk going because we never know what they're going to do. There's financial risk of verbal abuse. How you train your members to carry out their tasks should also be done safely. So if you're considering getting in work or just overhauling your health and safety stuff, make sure that you also make it industry specific as well. Just do it properly. So some examples of risks that we might not even see. So for the tidy towns, traffic, depending on where you're going to be, drunk drivers passing by, you know, what can we do? Try and maybe not do the tidy towns at 3 o'clock in the morning, but that doesn't mean that there isn't going to be somebody out during the day that hasn't been drinking and driving at the same time. Weather issues, there's a physical aspect to the role. What if their car is broken into when they're out doing something for the organization? What if they injure themselves with a gardening instrument? Sports clubs, then accident and first aid is usually what's planned for. But what about if a member of the other team becomes verbally abusive? What if a volunteer has money taken from them? What if a volunteer has been attacked on the way to or from the organization? Then we have family resource centres. So this can be very mentally draining on a volunteer. So have we considered this? Like, do we offer an opportunity to debrief, even if it's a Zoom once a month, just 10? We would do it a lot, like with HR, like you've no idea. My friends always say, God, you need to write a book or have a Netflix series, like the stuff that staff do, but you'd have to debrief about it because sometimes it's something that's you're listening to day in, day out. So just consider that people might need to debrief. Is the area well lit in the winter? What happens in an emergency situation? Then for community groups, you might have people of a different ethnicity or minority make a claim of discrimination. Have we facilitated our members on how to react to a claim like this? Chemical and biohazard risks occur in simple things like dishwasher tablets and washing up liquid. Do we have a first aid box? Do we have saline, which is just cool boiled water to rinse out any accidental allergies? So we've spent like 20 and 21 making plans for in the event of with COVID-19 transmission. We should use the skills, and I've definitely found it has helped with everything, using those skills to kind of put that on every other risk as well that you can be looking at in the event of what can I do, how often should I reassess it? So we should use those skills to make the organization a safer place. So you're going to ask me now how much this might cost, because people, their next question is usually, how much is this going to cost? And Tom said that to me as well. So I suppose the important questions for you are, how much would it cost you if you don't comply? Thousands will be incorrect, because it will be tens of thousands. So like fines with the HSA start at €10,000. The non-compliance fines start at €10,000, and it's never going to cost you €10,000 to sort out your health and safety stuff. But one breach alone would cost you that, and would close a lot of people, like, because that's a lot of money. That doesn't take into account any claims, insurance claims from members of the public, organization, etc. Insurance will not cover you if you've not had your health and safety documentation in order. So I'm going to give you a rough idea just of time and costs and things like that. So time is the main currency here. Somebody needs to get to know the setup and the structure of the organization. So with COVID, in-person meets aren't always possible, but if it's possible, there should be a site visit to allow for a physical or structural obvious risks to be assessed. Most projects then would take 4 to 6 weeks to complete, which would not on a full-time 4 to 6 week basis, which would include site visits for risk assessment, appoint somebody to undertake this internally, or somebody to liaise with your consultant, risk assess policies that you already have or policies that you need, and then the ones that you have and the ones that you have but you can't see, general risks other than dependent on the industry, feedback then, like how to give feedback and manage your risks and manage the actions. So that would complete your risk assessment. Your health and safety statement can only be drafted when you've completed your risk assessment. So even if you decide you just need help with your risk assessment part of it, or even if you decide today you're going to make yourself your self-appointed health and safety expert, I would say go over to the HSA website and just soak in all the information that they have there, because it is really helpful. When you have completed those, you then would be advised to turn your documents into a training manual or training Zoom. Like, this isn't something that needs to be anything certified or, bound thesis or anything like that. Put all the information together, put it on a Zoom or some kind of training guide. Usually, like I was saying, this is something we would do anyway, because actually there's no point in generic training on health and safety with people. They need to see on a Zoom, like, their canteen or their car park or the place that they're used to going into. They need to be able to see it to associate it so that it makes sense. So it's usually just a time thing. And I always say that to people, that like the minimum fine for somebody is 10,000, and it's not even going to cost you half of that to get help with stuff. Generally, if somebody's looking at spending anywhere from 1,000 to 3,000 or 4,000 euro, depending on how big the organization is. Like, sometimes people will do the work themselves and then they just call us in to look at the paperwork, and for that they just pay for the time, and obviously that's a lot less on them. So it's not something that needs to be a huge cost. I'm not here to sell you anything about it, but I think Tom just wanted everybody to understand, I suppose, the importance of the legislation, and that the legislation is there to be followed. And I was trying to simplify it and make it understandable without scaring everybody. So I'm going to stop the screen share and ask, is everybody still awake? And has anyone got any questions?
Hi, Denise, how are you? Thanks very much. That was great, very informative. I just have a quick question. So I'd be involved in organising events in the community, so lots of public would come along and do an event. I'm just wondering, would you recommend to do a risk assessment regarding COVID and the other risks on the one risk assessment, or would you suggest separating them out?
That's actually a really good question. So I would say, like, I've separated them out for clients, because you've no idea, like nearly my whole day has become like, I think of recording a voice thing and sending it to the HSC and see what they pay me for it. Because I seem to spend my whole day going 7 days, 10 days, 5 days, because everyone has the same question. So I've made it its entire thing, because there's so many different aspects to it, because we have like the testing, the close contact, the somebody wearing a mask, somebody not staying 2 meters. So I think on its own, there's enough there to do COVID as a project by itself. And I have a COVID document here, if you want me to share it for a second and just run through all of the different things on it, because there is, like, I think it's worth doing it on its own, because it's something that's going to be around for a while. Yeah. And it is, especially like when you're dealing with members of the public, COVID is your biggest risk at the moment, because pubs close early. We don't have the risk that we had anymore of maybe people being intoxicated at events. But yeah, I would definitely keep it separate. Okay. And there's templates out there then on those sites that you recommended that I can go on and have a look at. Is there? Yeah, the health and safety website, honestly, like, it's really user friendly. And sometimes, like, people always have doubt about it, but just because they're not used to it. Like, once you understand how to start risk assessing, how to put a plan in place, and then that any of your members or whoever's involved in the organization needs to be given a copy of it. So there is loads of help there, but it's not something that you need to go hiring, you know, in an engineer to do it. And I think sometimes that's what keeps people away from doing it, because of the fear of not knowing about it, but it's actually not, it's not that bad at all.
Okay, thanks.
Anyone have any? I'm going to quickly, as I have time, I'm going to quickly share a COVID document, the COVID Bible that I have, just to show you what I mean about keeping it all in the one book. It might just help. Unfortunately, we're still talking about it all this time later. Okay, so I'm going to screen share COVID. Okay, so just to show you, this is a COVID-19 manual that I've edited several times, because obviously there's been changes. So at the very start, the information we had was minimal. It was just about how it spread and stuff like that. And we've updated again there lately because things changed in it. So what we would have in it is our COVID-19 policy, and your policy is anywhere online. Your policy is, you know, what COVID-19 is, what your plan is to try and prevent it, an introduction. If somebody has done a particular certification, to, like, they don't have to, I just need to, like, you absolutely don't have to, but if you would prefer that, you'd like to do an online course to give you that bit more confidence on it, there's loads of courses that you can do. So if you have that, I would put that in as well, if you've done a certificate of compliance. Then you have your COVID-19 risk assessment. So I'll show you what that looks like there shortly. Then we would have a compliance log, which is in places, if you're operating daily, you know, like, for example, hair salons, shops, nursing homes, if you're operating daily and you've members of the public coming in, or you need to limit crowd control, like, you're going to have a compliance log. And the log is what you've made it. It's, you know, maybe you've decided to alter start time for the staff so that people aren't mixing with each other in the canteen, or maybe you're adjusting lunch times. So the compliance log is the list of stuff that needs to be complied with, and you keeping a record of it. A checklist, which would just be about that you've trained people, that you've provided PPE, staff training policy. And your policy is as simple as anytime you update it, you resend this. So anytime we've updated this to clients, I would send this out the whole time and just say, listen, the last 5 pages of the update, to stop them having to scroll through the whole thing. Returning to work questionnaire. So if somebody's been out sick, being vulnerable, or living with somebody vulnerable. So like back at the start, if you remember, in 2020 at the start, it was like, if you even live with somebody that sneezed 2 weeks ago, stay at home. Whereas now it's like, how long did he sneeze for? And is he vaccinated? And sure, like, let him back to work. So it's changed over time because we're short staffed and everybody's trying to figure out ways of how to manage it. So then we would have a responsible person task register. And that's a really good tool for giving people responsibilities for certain things. Like, somebody's job might be to make sure there's always hand sanitizer. I don't know if you've caught, like, if you go into shops these days, half the hand sanitizers aren't full anymore. And it just drives me bonkers, because they'll have a sign up on Facebook next week saying they're closed because they didn't have, you know, they got hit with COVID and they might have been out of hand sanitizer for the last 2 weeks. So responsible task person register, reactive plan, which is, okay, so that was our plan for, okay, what are we going to do then when there's a COVID outbreak? Like, what is our plan? Dealing with a suspected case, disclosure confirmed, and then reassessing the risk assessment. So the reassessment would be, okay, we were all trying to prevent COVID from coming into the workplace last year and the year before. And it got into most places. So then before we reopened, or before people came back, we had to look at, okay, so we don't know in particular if Maeve got COVID at work, but what we know is that, like, when Maeve got it, Denise also got it. So the day they were working together, even though it says that they washed their hands and they whatever, obviously they didn't. So we need to look at, okay, when staff are working together, do we move a till 2 meters away? So you're just looking at how you can reassess things to put in other controls. So I'll show you some of the documents here. So your policy is always just like what COVID is, and the HSE has an awful lot of information on that, you know, and just explaining like how people can manage it, how we try to defend against it. And the God, when I remember typing that, I was so hopeful back in March 2020 that, like, I wouldn't need to look at this document again. But anyway, so working from home, you might have put policies in place for that. And then it's more a list of forms. So we had businesses that were closed and that were reopening. If you remember the first lockdown, there was closures for a number of months. So people then had to put measures in place. So you could go into a hair salon and be like, okay, we need to risk assess this for reopening. And then you had to look at, like, you know, somebody's working with somebody's hair, or somebody's giving somebody a facial. So every industry had a specific amount of risks imposed by them from COVID. And that's why measures then were put in place, like with masks or splitting the team into A and B or opening on different days. So all of the forms on this, just to give them guidance on what they need to do. So this would be a sample risk assessment, for example. So let's see if I can zoom in on that. So basically what it would say is, okay, what is the hazard? The hazard is the spread of COVID-19. Who might be harmed? Staff, visitors, cleaners, contractors, drivers, vulnerable groups, anyone who physically comes in, delivery drivers, all of that stuff. So what are the controls required? Okay, so we have hand washing. So we have hand washing facilities, soap, antibacterial gel, people need to dry their hands, gel sanitizers, and then the additional controls. So additional controls are things that we might put in, like, you know, that we've advised the staff to let us know if they feel unwell, tell them not to be sharing drives to work with friends that work in other businesses. You know, if they're socializing at the weekend, that they're mindful, like if they're coming into work and if they're going to house parties and all of that stuff that just kind of tries to help us to prevent the spread of it. So it changed as time went along, because, you know, then we had lockdowns and people were saying, God, Denise, I saw like all of my team were at a house party on Facebook. And, you know, long before COVID, if somebody said Mary rang in sick, and I can see it on Facebook, she climbed car on tools so she couldn't be sick. Like obviously you can't do anything about it, but with COVID it was different, because the public health guidance was we need to do what we can to keep everybody safe. So if Mary is on her Facebook and she's at a house party and she's coming in the next day working or volunteering somewhere, like unfortunately we had the power to go and say, well, you know, you're not thinking of everybody and you're not thinking of the risk assessment. So the other things you had to do then was cleaning, social distancing, the wearing of gloves, PPE. So these are all the measures that we had put in place when everybody was reopening to try and prevent the spread of COVID-19. And obviously that has evolved over time because COVID has come in. We've lost, clients of ours lost staff. Like the first, I think it was about the May or June of 2020. And on a Sunday, one of the clients that owned like a retail chain up the country rang, and their deli manager, who was 35, passed away from COVID, no underlying issues. And I remember just being like, I have a big Bible on all this and I have no idea how to write this email, because I had to write an email to advise them that their manager had passed away with COVID. So even that stuff then taught me of, okay, maybe I need to put a support in place, that if I'm breaking that kind of news, I'm not qualified enough to give the follow-up support on it. So we have a risk assessment prompt sheet here as well. Just gives people like little prompts on what they should look for when they're risk assessing stuff. And this one is particular to COVID. And you're just looking at, you know, if you were risk assessing an ICU, it would be very different to risk assessing a canteen. It's different in every place. So just to scroll down and show you some bits, work environment controls, are there appropriate hand washing facilities? So you could do that for a public event, just so that you have it done, so that if somebody decides, oh, I was there yesterday and I'm sneezing today, I don't know if they had any procedure, I'm going to make a complaint to the HSE. Like, it absolves you just having a procedure in place, and that you have looked to try and make things safer, and having a couple of signs up and telling people what the expectations are. These now would be very detailed, because it depends on different places, but then returning to work or reopening, you know, post COVID. So you're wondering, are you aware of the signs and symptoms? Do you know how the virus is spread? So it's a rehash of stuff. And way down, I think, yeah, it's 45 pages now. It was 30 when I started. Way down at the very end, then we have stuff like how to apply for sick leave. So this will be in relation to schools then, like the ventilation, disinfectant, hand sanitizer, people that would give maybe special needs assistance, or people that are doing childcare in their home even after school, which obviously isn't an employment, but they still have a level of responsibility. So everyone kind of needed to have their own protection on it, because nobody wants to be putting anybody else at risk. Disinfection, a policy on that. And then the last part of it is what everybody is asking lately, is if I'm vaccinated, if I'm boosted, how long do I stay at home? Where do I get the payment from? So yeah, we updated it there on the 5th. So you'll see it was the latest guidance from the close contacts and all that. And that's literally what we keep getting asked all the time, how many days? So I just keep resending them the document now, because I'm blue in the face from telling them how to contact the days. But even then, the payment thing is another thing. Like sometimes nobody's any idea when they're off sick, how do I claim stuff? And especially a lot of the staff that we would have for places that aren't Irish, you know, just expect maybe that the employer will look after it. And the whole system is reliant on mywelfare.ie, which isn't great at being timely about it. Like people could be out sick for 2 weeks before they even get an email back. So there's a whole financial risk there to somebody if they're going on layoff or if they're going on PUP because they won't get paid for a couple of weeks. So those are all the different things. And that's why you would be correct, Maeve, to keep it as a separate thing, because it's something like never before. Like it's evolving the whole time. The risks change, the guidance change, the isolation days change. So naturally by default, if you have an event today or an event in June, the rules for both of those things might have changed as well. So,
and can I just ask as well, Denise, sorry, just while we're on that, so where does the line, I suppose, or where does the responsibility start and end with, say, somebody like me who's, say, renting out an outside pitch with the public coming, and I'm doing everything, like I do everything I can to make sure the sanitizer there, and you know, but then I'm relying on the centre to make sure, I don't know, one-way system, or that there's signage in the building. I mean, I can't go in and put that in there, but do you know what I'm trying to say? So what do I say on the form, on my risk assessment, like regarding that? You know, where does my responsibility start and end, I suppose, when I use a public facility?
Yeah, so a public facility should have its own procedures on it. Like, and there's no harm if you're paying rent to something, there's no harm saying, guys, could I have a look at your safety statement, because I need to do my own. And as I'm leasing this from you, I just want to see, you know, because it's okay for you to put some of that information into yours. So as long as you have risk assessed yourself, so like the building isn't your responsibility. If people that come to you for whatever it is that you're doing end up using some of the building, the onus is on them to make sure this building is safe. But your risk assessment should state that, you know, the people that you're leasing it from or the owners of the building have advised me that they're keeping all of the COVID-19 guidelines, you know, that they have them safe and they're following protocols, they're operating a one-way system. But I would ask them for it. And even if you need a copy of it to refer back to, because that is their obligation. And like generally most of the time, it's fine. You can only do a certain amount. And when you're saying, where does my, you know, responsibility start and end? Like it starts with absolutely get it in writing. And like my annual clients know not to come near me if they don't have the paperwork. I always say D for Denise and D for documentation. Don't come near Denise without the documentation, because that's all somebody asks for me. If somebody falls or something happens, whether it's COVID or whatever, you'll be asked for the paperwork. And it doesn't matter if you've done 20 online courses. In the absence of paperwork or evidence, they make an assumption that you haven't carried out any procedures or any assessments or anything like that. So as long as you have your risk assessment in writing, and if the building is not yours, you're renting it off somebody, get a guarantee from them that they're adhering to, even if it's an email where they say, yeah, we're adhering to the COVID-19 guidelines, that's enough then that you've gone and asked about it. And all you can do is take them at your word. You're not the HSA responsible to be chasing them up to make sure they're doing it. But just in case something ever happened, I would get the security for yourself.
Perfect. Yeah, perfect. Thanks a million. Yeah, that's great.
No problem. Everyone else is very quiet or tired.
Sorry, Denise. How
Yes.
you doing? Brian from Banner, just bailing in here for 2 seconds.
Hi, Brian.
I know you were saying you're not selling stuff, but just as a point of information, as a 100% volunteer organisation ourselves, for years we would have assigned a few people to update our health and safety policy and so on. But in 2018, after a major review of our policies, we were told by one of our overarching organisations that we should have a safety consultant sign off on all the policies, mainly because we're 100% volunteer and of course as best practice. So what we do is we do the document and then we bring in a safety consultant, because if there's anything under a HSA review, it's the volunteers that write the documents. If they don't have the necessary safety, they may be experts in the area, but if they don't have the necessary safety consultant qualification, stuff like that, they're in trouble.
So is it a cost thing that you would pay? Do you pay somebody per document or per time or kind of retainer? How do you manage the cost of it?
Well, we've kind of got we've 3 or 4 daddies. We've got Water Safety Ireland, Irish Coast Guard and so on like that. So we get documents reviewed by them, but the internal documents for your own occupational side and our own local operating procedures, we would write them and then we call in, say, an expert in water safety, a safety consultant in that area to kind of review the stuff and make sure we're on track. But it'd be best practice. Again, I know you're saying you're not selling stuff, but just as a point of information, tell everybody else, it's as best practice, it would be good to have a safety consultant sign off on what you're writing.
Oh, absolutely. And like, you know, Tom said to me the last day, like, you know, they might ask you about cost. I'm always very clear with people about cost, because we do a lot for the individual. Even in terms of HR, we do a lot of business HR, and that's our main bread and butter. We'd have business clients on a retainer. But if an individual who's been unfairly dismissed comes for advice, like those people are usually on unemployment benefit, and they might wait 6 months for a hearing, and a lot of people just take a percentage of their claims. So we don't do that. We only ever just charge for time. And you'll see on the website, people can book our time for 15 minutes, 30 minutes, or an hour. And generally, if it's reviewing documents, I tell people, send me the document, book in an hour. If you need an extra hour, I'll tell you. And the costs are there, like the hour is €65, the 15 minutes. We've 15-minute option, because like literally last week, the CEO of a credit union had one question and didn't need a HR or health and safety company and just booked. So we have kind of, our thing is that it's a pay-as-you-go service, and it's worked well for us for the last couple of years, because it just means smaller organizations don't need to be paying 4 or 5 grand to have access to ask us something once or twice a year. So if somebody wants a document reviewed or a safety signature on it, I always tell them, book the hour on the website, send the document. We're in HQ in Tralee. If anybody is local, they're welcome to come up as well and bring the document in, but it's an hourly rate based on that, and there's no additional charges unless somebody needs us to travel somewhere and there's travel charges and stuff. But like, that's kind of the baseline of an hour's work will cost you €65. So it's not definitely not about selling thousands of euros of a service or anything like that. Now, sometimes people might say, we've no health and safety stuff, I need someone to come in and do it all, how much is going to be? And that generally would take 4 to 6 weeks, purely because you couldn't give it full-time attention. Like we have, there's 2 other girls that work for me. It would be something you do over time. So you'd be looking at probably a day a week for 4 to 6 weeks, but that is always still based on the hourly rate. So if I'm giving somebody a day a week, they're paying 8 hours by the €65 by 5 or 6 days or whatever it takes. So the cost is always clear and just goes on an hourly rate. I think that's fair to people. And I think a lot of the voluntary bodies, even though Tom sometimes tells me there's a magical pool of grants and funding and stuff, and sometimes there might be for health and safety stuff, I think as well with voluntary bodies, like you're better off to just charge what the work costs you in terms of time, and they might recommend you to 10 more people. Just make sure anyone else has any other. Does that answer your question, Brian? Sorry, is that?
Yeah, that's perfect. Thanks.
But I do think it's important, sorry, Caroline, here, I do think it's important, Denise, as well, that I think organisation and people, they can do a risk assessment, but I agree with Brian as well. I think it's important to maybe get somebody in, because sometimes people and organisations and centres can be sitting in the middle of risks that they actually don't really see as well. And sometimes you need that person to come in so they can do a large body of the work. But sometimes it's also hugely beneficial to get somebody in just to make sure that they're not missing something that's very clear and blatant that needs to be documented. And it's good to have the knowledge here that it gives people and groups and organisations food for thought to go away and think about what they have in place and what they might need to do going forward as well. And just to remind everybody as well that all the information we'll be sending out after our second set at the end of the week as well. So you'll have it as well to go through.
Yeah, and that is actually a good point. Like sometimes when you're used to looking for it all the time, you know, it's like if something goes wrong with the car, it goes to the mechanic. You know, like if you're looking at risk, the thing about risk is when you look for it the whole time, I over look for it. Like I'm sitting on a plane to Portugal and then I start freaking out going, oh my God, that fucking air jacket is not going to do anything for anyone. Like, why did they go through this the whole time? You know, you're sitting there going, nobody's going to hear that whistle in the middle of the Atlantic Ocean. Like, why do they go through this? But they do it so that we can't sue them, or our families can't sue them when we're stone dead missing in the water. You know, this is like some of the stuff people put in risk assessments just because they have to. But when you're more used to looking at it, you look at it, and it's probably like everybody's specific industry. People are looking, you know, they're used to looking at particular things. So it is, even if somebody, the best thing to do might be to jump on a Zoom, talk about what your setup is, and then think about the potential risks. But even after today, you should be able to consider some additional risks that maybe you hadn't thought of. And obviously COVID being the biggest one, if there's any members of the public or we're trying to do any meetups and stuff like that. But in terms of like responsibility and obligation, like being active on it and trying to do your best at it is enough. Like the HSA are very fair. They get a lot of malicious complaints, like they've had a lot lately. you know, people quarantining with COVID and the boss may be contacting them, and they've had malicious complaints whereby staff members are saying, oh, John rang me 3 days in a row when I was out sick with COVID, and that's not a health and safety complaint. And I've seen the HSA writing back saying that complaint was malicious from an employee, we're not going to follow up with it. Like they only come down on you if they need to come down on you. And even at that, if they were doing an inspection, you'd be notified of it, you'd have a chance to sort it out, and they'd give you a chance to correct it. So, you know, they do aim to work with people. But definitely, if you have any serious concerns, like, do reach out if there's something that you're just worried about. Like, Maeve, if you definitely have people coming in at something, even if it's outdoors, I would just put your COVID measures in writing, just so that you know you've done your bit. You've told everybody. You can't be responsible for the ones that are going to go around hugging each other and not believing COVID and all that stuff. But you've done your bit. You're not responsible for them then.
Very good, Denise. Absolutely fantastic morning of information. Thank you very much.
No problem. I'm doing the one on Thursday again, I think. But even like, guys, you'll be able to find the website pretty easy. It's watchyourbackIreland.ie. But if you want to, like, if you have a quick question, send a quick question on an email and I'll answer it on an email. Like, you don't have to book in a consult every time if somebody has a question. Like, it's not, you know, we're not a big firm. We don't operate like that. If somebody needs help with something, just fire a question over and there's no bother. And if anyone doesn't know where to start, you can't remember any of the websites, I'll send the slides on actually to you, Caroline, so you can send the slides out if you want and people can have a look then.
That should be great, Denise. Yeah, because I think it's important that, because there's so much fantastic information here, I think it's always good for people to then, when they get the slides, to sit with them and to reflect on what they've done as well. So we'll have that out to all of you by the end, we'll say the end of the week, because we'll wait until after Thursday nights as well.
Okay.
Okay.
Yeah.
Okay. Well, if you're sure you have no more questions, I will jump off. But do, as I said, like, get in touch or send an email, or just don't be stuck, but do use the HSA website. Like, you'll find an awful lot of resources there before you have to spend any money.
Sorry, Denise, just a quick question. I suppose we're a childcare centre and we're renovating the roof, but the centre will stay opened. Now, obviously, the builders will have their own health and safety in relation to, you know, the roof and stuff, but do we as a centre and, you know, have to do our own policy around that?
Yeah, so what you would be looking at is basically like, so obviously that might change where children go for a period of time. Like, will you be sharing rooms, or
we'll be getting alternative entrance points to the building, you know, and I suppose, you know, like, it comes with its own risk, but I know they'll be doing their own risk assessment on it and stuff. But do we have to do something as well, do you think? Or is it?
So their one, like, is for them and it's their responsibility, and if anything happens with the building and all that, but for you, for your staff, and even for the parents, and if only that, it stops the 500 questions of every mother and father asking you, like, what's going on and what will they do. So all you would need to do, like, if your entrance to the place or your exit is changing, that's a substantial change to people, to the usual procedure. So that's something just to advise them of it. But even, you know, let them know that you have considered that it's the winter time, and that, you know, if people have concerns about the building being warm or COVID or anything like that, that you've risk assessed all that and that you've made a plan. Or even for the staff, just, you know, think about if it changes anything where somebody has to park or where parents park, or if it makes a change to the run of anybody's normal day, dropping kids off. Because I know we have a couple of childcare centres, and I know COVID itself is like, it's closed for a week. And then this morning I had a girl, she's pregnant and she was off sick, and her doctor was like, I want to sign her off. And she said to me, I think I'll come back though. I was like, if you think I'm going to override a doctor telling a pregnant woman to stay away from her during COVID, like, I don't have that power. So yes. I would just put a policy together for yourself on what way it'll work, the expected time frame, how you'll communicate any changes with people, and I would just bang it out. Like, it doesn't have to be any type of extensive document or anything like that, but just that you've looked at it to risk assess how any changes might affect people, and answer the questions before they're questions, you know, about, oh, will they be mixing with other children? Will the staff be mixing more? Would it be colder? That kind of stuff. Because, you know, some parents will have questions.
And would you email this to parents? Would you, like, I suppose we have the centre, but then we have other services renting rooms, you know what I mean? So they'd have their own personal services. So would you just send your policy on to the tenants, and it's up to them then to distribute to their families? Or How would it
I
work?
would definitely let the parents know, 100%. I'd definitely let the parents know. But even with the tenants, I would, and this, you can do a one size fits all. You know, there's nothing in it that's confidential between
Yeah,
you know, about a specific child or anything like that. But I would definitely, even as a memo, like type it on a document and send it out as a memo. It doesn't have to be anything formal. It's not any part of a formal process. It's just kind of an advisory thing. But it protects you from a load of questions and you're being proactive about it. Like when you're proactive, it'll limit all of the questions and people asking for what you're doing. And, you know, you might like to look at it to risk assess it, like where are the builders going to park? Where are they going to go for lunch? You know, if there's a day that there's no electricity, you probably have stuff for that kind of thing already. But no, I would definitely issue it out, but I wouldn't overthink it. It doesn't need to be your complete health and safety document. It's more about that there's a change that's going to affect the running of the normal kind of routine.
For a couple of weeks and just
Yeah.
to inform parents. Okay, brilliant. Thanks so much. Appreciate
No
that.
problem. Okay, I will let you go, so guys, but as I said, do pop an email if there's any questions. I really don't mind it. Geraldine, were you raising your hand there? Sorry, wasn't sure if you were.
No, it might have been you, but it's a nice opportunity to say thank you. I was just actually going to type. I saw Sharon's comment coming in from the stool. So I was just going to type in a thank you message. So it's just nice to vocalize instead. Thanks, Sharon, for giving me that prompt, and Denise and Caroline and Eamon for organizing it. Much appreciated.
Thanks, guys. And honestly, I
Very
like
much.
the really good thing about Kerry, I find, is that even in whether it's business or not for profit, everybody's always supportive of each other and everybody's willing to give somebody a hand with stuff. So that's what I mean when I say I'm not selling anything. I mean, if you need a hand with something, reach out. If you need a big hand with a big project, that's fine. But like, don't feel like you can't email me to ask a few questions, or Fiona, if you do up a draft of it and you want to email it on to get me to look over it, send it on. Like, there's no harm.
Brilliant. Thank you so much. I appreciate that. Thank you.
No problem. And I see the couple of messages there. Thank you. You're welcome. Tom said to me yesterday that the slides had looked scary, so I'm glad everybody is still here. That's why.
No, I think the slides have been great, and I think the session has been great. And I often think as well, when people ask questions, it kind of prompts to your own thinking as well of things. So I think that can be really good. So thank you all for coming this morning, and thank you, Denise, as well, and of course Eamon in the background with the old IT backup. And just to remind you as well, keep an eye on the PPN website, because all the training is listed there, and we'll be having another session of this on Thursday evening. If you want to pass on the word, we'll be sending out more information. And next week then we'll have a session on the charity regulator and good governance, and we'll have the details. They're up on the website, but we'll have the links going out at the end of the week as well. So again, thank you all so much for attending this morning.
Thank you. Okay, take care. Bye-bye.
Great.
Thank you.
Thanks.
Yeah,
Bye.
thank you. Bye.
Thanks again. It was very good. Thank you.
Thanks, Fiona. Take care.
Brilliant. Thank you very much.
Thanks, Margaret. Take care. Bye-bye.